Welcome everyone. Today we will discuss about lateral medullary syndrome. First of all, we have to learn the anatomy, then we will find out what lateral medullary syndrome means. If you can notice, above all there is midbrain, then there is pons, and then there is medulla. And the medulla is divided into two parts, the pons, which is situated centrally, and then there is olive, which is situated laterally. And if you can appreciate, there is cerebellum on both sides of the medulla. The cerebellum is also present on both sides of pons and midbrain as well. The midbrain is connected with the cerebellum with superior cerebellar peduncle. The pons is connected with the medulla with middle cerebellar peduncle, and the medulla is connected with the cerebellum with inferior cerebellar peduncle. Now, as the name suggests, the lateral medullary syndrome, the structures situated or transpassing the lateral aspect of the medulla will get affected in lateral medullary syndrome. Now, let's find out what are the structures situated on the lateral aspect of the medulla. First of all, look at that cranial nerve 9, 10 and 11. These three cranial nerve nucleus are present on the lateral aspect of the olive or the medulla. But the cranial nerve 12, which is situated just lateral to the center in the ponto-olivary junction, this nerve will not get affected in in lateral medullary syndrome. Then in the pons, you can see that cranial nerve 6, cranial nerve 7 and cranial nerve 8, these nerves nucleuses are present in the ponto-medullary junction, but cranial nerve 8 is situated the most lateral. So cranial nerve 8 will get affected in lateral medullary syndrome. Moving on, the cranial nerve 5 is situated upward in the pons, but it has three nucleuses, and these three nuclear fibers will go in three directions. The cranial nerve 5 first fiber will stay in the pons, one of the fibers will go up into the midbrain, and one of the fibers will descend down into the olive or lateral aspect of medulla. So this fiber of cranial nerve 5 will also get affected. So the situated structures, as you can see, cranial nerve 9, 10, 11, cranial nerve 8 and cranial nerve 5. Now let's look at the fibers transpassing through the lateral aspect of medulla. From the hypothalamus, the sympathetic fibers descend down from the lateral aspect of medulla into the spinal cord. From the spinal cord, the spinocerebellar tract ascend upwards, transpassing the lateral wall of the medulla into the cerebellum. Then the most interesting part, into the spinal cord, there are three horns: the ventral horn, the dorsal horn and the lateral horn. Now, as you know, the dorsal horn contains the vibration, the fine touch sensations, and which fibers go ipsilateral. That means those fibers don't decussate to the contralateral side, but it goes up from the same side. But the fibers from pain and temperature, which are present in the lateral horn of the spinal cord, those fibers decussate to the opposite side, then it goes upwards. So these fibers are contralateral fibers, not ipsilateral fibers. Contralateral fibers, all right? So as we can see that cranial nerve 9, 10, 11, cranial nerve 5 nucleus, cranial nerve 8 sympathetic fibers, the spinocerebellar tract and the lateral spinothalamic tract, which contains contralateral pain and temperature. These structures highlighted by the green highlighter will get affected in lateral medullary syndrome. Now, how does the lateral medullary syndrome occur? It can occur due to any kind of lesion, any kind of accident, any kind of injury, or any kind of embolus, thrombus, or infarction, which affects the pica, the artery which supply this area of medulla and cerebellum. And what does pica mean? It means posterior inferior communicating artery. Now let's see what are the clinical features we will get when lateral medullary syndrome occur. Now, if the facial nerve 5 fiber get affected, the facial sensory loss will occur, but it will occur of the same side. Now, if cranial nerve 8 get affected, the vestibular dysfunction will happen. If cranial nerve 9, 10, 11 get affected, there will be dysphagia. If sympathetic fibers get affected, there will be Horner's syndrome. If spinocerebellar tract get affected, there will be ataxia. Now the tricky part here is the opposite pain and temperature loss. Now if the pain and temperature of the lateral horn get affected, the fibers from the opposite side were going through the lateral aspect of the medulla. So the opposite pain and temperature loss will be affected for lateral spinothalamic tract. So these are the clinical features that will be found in lateral medullary syndrome. So if we can appreciate the structures which are involved in lateral medullary syndrome, we can easily answer the questions regarding the findings of lateral medullary syndrome. Again, facial sensory loss for cranial nerve 5, vestibular dysfunction for cranial nerve 8, dysphagia for cranial nerve 9, 10, 11, Horner's syndrome for sympathetic fibers, ataxia for spinocerebellar tract, opposite pain and temperature loss for lateral spinothalamic tract, which were going to the contralateral side and then were ascending upwards. Thank you everyone.